A 65-year-old man presents for syncope. He has a medical history of hypertension, diabetes, coronary artery disease, and heart failure. On arrival to the hospital, an EKG is obtained and is seen here. On exam, the patient is somnolent and fatigued, and as you attempt to obtain further medical information, he syncopizes again. Which of the following medications is likely present in a toxic level? The correct answer is digoxin. Digoxin is used therapeutically as an inotropic agent to increase myocardial contractility and also as a rate control agent to decrease conduction through the AV node. The drug inhibits the surface sodium-potassium ATPase, which alters the sodium gradient of the sodium-calcium exchanger, leading to increased levels of intracellular calcium, resulting in increased inotropy. Digoxin also increases the vagal activity at the SA node and AV nodes. At toxic levels, digoxin can cause almost any arrhythmia or conduction block. However, certain arrhythmias are more specific for digoxin toxicity, including slow and regular atrial fibrillation, junctional tachycardia, atrial tachycardia with a block, and bidirectional ventricular tachycardia, which is the arrhythmia you see here on this patient's EKG. This EKG has the characteristic appearance of alternating amplitudes of QRS complexes. In acute toxicity, patients can also experience a variety of non-cardiac symptoms, although nausea and vomiting are almost always present. Hyperkalemia is the most severe electrolyte abnormality associated with digoxin toxicity, and prognosis is correlated with serum potassium levels. For example, patients have a significantly higher mortality when potassium serum levels exceed 5.5 milliequivalents per deciliter. Visual disturbances in digoxin toxicity is a classic presentation typically described as the patient seeing yellow-green hues or yellow halos in their visual fields. Other visual problems in cases of digoxin toxicity include photophobia and diminished visual acuity. A fun fact about these visual disturbances is that it's been hypothesized that Van Gogh may have been under the influence of digitalis toxicity, which is a genus of the plants that include the foxglove plant, which digoxin is extracted from. This hypothesis is based on Van Gogh's later paintings, which were characterized by yellow hues or halos. Additionally, he had twice painted his physician holding a foxglove plant. Critics of this hypothesis have suggested alternative reasons for Van Gogh's yellow color palette, including chronic solar injury, glaucoma, and cataracts. Amiodarone may lead to torsade de pointe as a result of QT prolongation in terms of ventricular dysrhythmias. It is relatively uncommon and typically occurs in conjuncture with other QT prolonging agents. Propranolol is a beta blocker. In cases of beta blocker toxicity, the cardiac manifestations include severe bradycardia and hypotension. Other findings may include altered mental status and hypoglycemia. These agents do not predispose patients to ventricular arrhythmias. Flecainide is a class 1C antiarrhythmic that does have proarrhythmic effects in some trials and was associated with increased mortality. Therefore, its use has been decreased. It does slow conduction through the AV node and His-Purkinje system and causes prolongation of the PR and QRS intervals. As a result of impaired conduction through the AV node, it may also cause first and second degree heart blocks. It does not affect repolarization, and therefore has no effect on the QT interval. If you like this case and enjoy medical cases like this one, check out Clinic, which is our new subscription-based web application, where each week we present you with new clinical encounters and multiple choice questions based on a variety of medical pathology, from common disorders to the rarest diseases. Each week, your digital clinic is loaded with brand new cases, which are carefully crafted by our team members, exposing you to medical pathology you otherwise might not have had a chance to see or learn about at school or in your clinical practice. Subscribing to the Clinic app is also a great way to support this channel, allowing us to keep creating great medical educational videos, interactive software, and more medical cases like this one, for free on YouTube or at an affordable price on our website. But if you don't feel strongly about supporting us this way, that's okay. We still would like to show our appreciation to everyone who has continued to show their support for this channel over the years. And as a token of our appreciation, we've created a free collection of medical cases that you can access on our website. Just sign up for a free med school account by visiting the link in the description below. After you've successfully registered, you'll be redirected to the free collection landing page, where you could add the collection to your account, and from here, you could immediately start testing your medical knowledge with the various clinical encounters found in this collection. You'll also have unlimited access to this collection, so you can repeat and attempt these cases as many times as you would like, forever.